And what are we going to do for you today?
Well, the reason why I made an appointment was because I suffer from migraines.
Okay.
I've always had really bad headaches, but my headaches have been lasting a lot longer than usual. Sound bothers me. Sometimes light. I have two little ones, so
Sure.
and sometimes I just need to be in the dark, or I wear my sunglasses like to school.
Yeah.
And it's not until recently that I just feel like nauseous, like I have to throw up,
That's
and
part of the
I feel
migraine.
dizzy. And so I know that like severe cold and when it gets hot, it triggers my migraines, but I don't know why I don't know why I get like I don't know why my headaches don't go away, and I take like ibuprofen 800. I've tried Excedrin. Like when it rains, I notice that I get like it's weird.
It's called an aura. You know it's coming.
I know that something is coming, or I can feel it when I start to get like sick, or sometimes when something smells funny, my headache starts to hurt.
So you want me to try to prevent it for you, and if you get it, get rid of it quickly, right?
Right, or what can I do, or...
Sure, let me get this straight.
Okay.
You're a mom?
Yes.
2 kids?
Yeah.
You go to school?
I go to school.
Probably take care of the house? That's a lot of pressure.
I work too.
And you work? What kind of work?
I help for CPA firms. I do admin for CPA firms.
So listen, you still got to do that, and the headaches can make it difficult to perform.
Yeah.
But actually, all those stresses could be contributing too. I have you to understand. So before I give you the treatment to prevent it and to get rid of it once you have the headache, we call it aborting the migraine.
Okay.
There's specific medications to prevent, specific medication to abort, stop the migraine. Before I start, I want to tell you that migraine is usually triggered by something. You already said barometric pressure, temperature, weather changes, stress, and so those you already know, right? But generally, the triggers can also be food items, and what's commonly understood is preservatives. And things like chocolate sometimes trigger migraines. So the important thing to understand that if there are triggers, it's beneficial for you to try to identify the triggers the best you can.
Yeah, I've noticed that coffee triggers my migraines.
Yeah, it's ironic, isn't it? Because coffee can sometimes help the migraine, but if somebody, so once you can figure that out, it's better that you don't have the coffee. Then you don't need the medicine, right?
Yeah.
But we know it's not going to be perfect, and there are blood tests to figure that out, but that takes expense. So my advice for you is to minimize exposure to things with preservatives. So when you open a jar of pickled something, there's preservative in there. That might trigger your headache. So if nothing else, at least try to figure out if those are contributing. So you're having a sandwich and it's just like bread and cheese and cold meat, and any of those could cause triggers too. Bread, cheese, and things like that, mayonnaise, dairy could. But it may not be any of those things. It could be the preservative on the cold meat. Right? And the reason I say that because from my experience, preservatives are like sulfites and benzoates. These are the ones that actually not only create migraines for people like you, but actually create other neurological problems like autism and hyperactivity. Because preservatives do that. Additives, preservatives, they're chemicals, but when you consume them, the bacteria tries to process it, and then it sends messages. And those messages trigger migraine for you. They can trigger messages where they excite the brain, irritability, excitability, hyperactivity. And so the first thing I tell parents with say hyperactive kids, it's not the sugar, it's the coloring and the chemical and the preservatives. Those are the ones that cause it. So you're the same. You don't have that problem, but yours is migraine. But guess what? It's part of the brain.
Right. Yeah.
So whether it's autism, or it's hyperactivity, migraine, or headache, it's neurological.
Yeah.
Those chemicals are terrible. They go through the blood-brain barrier and create a problem that triggers, in your case, migraine. So keep that in the back of your mind, that things which are preserved are the ones you got to stay away from. So I always bring up sandwich because everyone thinks that, well, if I put a piece of lettuce and a piece of chicken in there, that's a wonderful, healthy food. That's what Panera says. I'm going to give you a joke. The new ad for Panera is clean food.
Yeah.
So my statement is, was it dirty to begin with? That's just a joke. And secondly, it's not food at all, because the bread was processed out of grains. All the good stuff is gone, and the bread is the least, the most processed, right? And then one piece of lettuce doesn't count for vegetables for me. One piece of tomato doesn't count as vegetables for me, right? And then usually they fill it with what? Cold meat, tuna, canned, so nothing good. Right? Unless you're grilling your own chicken and you're grinding your own flour and making your own bread, then I say it's clean, right? But it's a joke. But so the alternative for you is, as much as I'm going to spend time on the treatment, I want to spend just as much time trying to tell you that you, of all people, have to make your own food. So dinner is usually good because you get a lean piece of protein, like a piece of fish or a chicken. Then you put some starch in. I personally don't eat a lot of starch, but if you do, potato, maybe, what else could there be? Starch, potato, and I don't like pasta myself because they're processed. But at least you have vegetables in there, and you'll think more like a real food. None of that's processed, right? Potato's not processed. The vegetable's not processed. The lean protein's not processed. That's how you should eat for breakfast and lunch. Something like it. I'm not saying it has to be exactly the same. When you start having a pancake, or you have a bagel, or you have a cereal, you're now introducing packaged food. They will have some element of preservatives, coloring, and so forth. Okay? So whatever I said to you applies to your children now.
Yeah.
Now, I know it's difficult, but understand my principle, apply it for yourself. When you see the benefit, then you'll say, why would I want to poison my children? Now, all that I'm telling you, I didn't do for myself when I was in my 20s and 30s. Well, my baby started when I was 30s. But I didn't do it. I had no knowledge. I didn't understand. So I'm giving you information which you don't have to apply 100% right away. Apply some of it. But in your case, apply a lot of it, as much as you can, because when you see the benefit, you won't need the medication.
Yeah.
But I will tell you about the medication now in a second. So just going back, the most important thing is your children.
Yeah.
Do it for the sake of your children. You use it as a motivator, and you'll find that your migraines will go down, right? But let's not overlook the obvious. You go to bed late, you're going to set yourself up for a brain that didn't get rested. And if the brain is not rested, it's going to be susceptible to being triggered for migraine. You're under stress from the work, your family, financial. It's not an ideal world, but understand that those also contribute, right?
Yeah.
Okay? When you exercise, your body feels good. When you eat good, your body feels good. When the body feels good, the brain feels good. Hands down. Hands down. Because the most important thing about a migraine to understand is that the blood vessels in the brain are triggered by the chemical, so they become constricted, narrowed. That's not a migraine. When they open up, dilate, that's the throbbing migraine. So the medicine that we use to abort the migraine, to stop the migraine, we use medicines to make the blood vessels in the brain shrink, the arteries actually. The veins and arteries, it's the arteries. So first of all, the trigger caused them to narrow, and then afterwards, the response was to dilate.
That's why I feel the throbbing.
Throbbing, yeah, literally.
I feel pounding.
And that's exactly what's going on with those blood vessels. So migraine is not a headache, it's a blood vessel disorder, in my mind. First, I told you there's triggers, avoid them, and then we're going to use medicines to narrow it. And so my next strategy, after I explain to you about using medicines to prevent it, using medicines to abort it, is to help you make your blood vessels so healthy that they don't become too small or too big. Health of the blood vessels is dependent on many, many factors, because those blood vessels in the brain are no different to the blood vessels around your heart or your legs or your muscles. And so that's why it goes back to good eating, good exercise will not only help your blood vessels around your body, will help the blood vessels around your brain. And there's no specific study for this, but I suspect it'll also prevent the frequency and the severity of your migraines.
Yeah.
Just by understanding what I just said, let alone starting some specific therapies. They're generally natural, nutritional therapies, vitamins, frankly.
Yeah.
So what type of medicines do we use? What you described, if you remember a minute ago, you said that you even know when the migraine's coming.
Yeah.
There's a sense. Some people smell it, they can hear it, there's just a sense. We call that an aura. Those people with aura, we use a special type of medication called calcium channel blockers, verapamil to be specific. And verapamil has been more effective than, say, beta blockers at preventing the migraine. They prevent them because both of those classes of medicines were actually designed for blood pressure medication. But what they do is they relax the blood vessels. It goes back to the health of the blood vessels, right? We're going to use medicines to help you, but you can help yourself by exercising, nourishing it. Any good food will nourish your blood vessels, but omega-3 will nourish your blood vessels, vitamin D will nourish your blood vessels, antioxidants will nourish your blood vessels. When you exercise, you're actually nourishing your blood vessels, because as you exercise, the blood flowing through the vein, through the arteries, makes the blood vessels produce nitric oxide, which makes the blood vessels very big and healthy. If the blood vessels are big and healthy, they don't become narrowed with triggers, right? They're more resilient and more resistant to triggers, okay? So that's the preventative. The unfortunate thing about preventative medicine is that you literally almost have to take it every day.
Yeah.
So I'm going to tell you, if you're a candidate, to take it every day. People who get, say, one migraine every 6 months, there's no need to take a medicine every day. If you get a migraine once a month or twice a month, some people say that's often enough to use preventative. We call that prophylactic medication. It really depends on you. If you are immobilized with your one migraine a month for like 2-3 days, it's bad. You may want to take a preventative medicine. And 2 of those where you last a whole day and you're incapacitated, you might want to take a preventative one. But anytime someone says, I have a migraine every week, 1 a week, that's plenty. You should do something to prevent it. Because my definition of migraine is something that really knocks you out. You know, you just don't want to go out, you can't cook properly, you can't play with your children, you just want to go to a dark room and go to sleep.
Yeah.
Which is kind of what's going on with you, right? You want to turn off the lights, go to the dark room.
Yeah, but I mean, I know that I still have to be functional, so I just,
No choice.
you know, but I do feel like it helps when it's quiet and it's dark.
Yeah.
So I'll do, you know, maybe I'll tell my husband, stay with them 10-15 minutes
Yeah.
because I need space.
This is an example of a resilient mom, right? Yeah.
And then, and so he's like, okay, because he gets it too. He
Yeah.
knows how bad they get.
They're really bad.
But they get really, really bad twice a year.
Yeah.
And I've been keeping track of them.
By the way, you're documenting all this stuff. I hope you have a good memory.
Oh.
You're the scribe. Yeah, go ahead.
And
So how often does it happen?
So those really bad, and so I know that I kind of Googled everything, and so those are like episodes that are really bad, but then I'll get migraines that aren't as bad as those, but I'll get like a ringing in my ear, or and I know that they come like when it rains. Like right now I have a migraine, and so I know that the rain is coming.
Right.
I have a really bad headache and I feel throbbing in my head, but I'm still functional even though...
You just have to, because you're a mom and you got to struggle through it. But really,
Right.
So we're going to help you. I think that it's worth for you to be on verapamil. We start on a low dose. We don't go
Yeah.
to a full blood pressure dose, because it's not about the quantity of the medication. It's just the fact that they are calcium channels, so they relax the blood vessels. So verapamil, you'll find the dosage in a minute. We'll find the lowest possible dose for you. And my advice is that take it at night, because
Okay.
you don't need your blood vessels in the middle of the night. You're sleeping,
Yeah.
and your body will get used to it. And then once you do that for every day for say 1 week, you'll know soon enough. You know what? The migraines will already come down.
Yeah.
If they don't, then you and I can talk, or just then you increase the medication a little bit, right?
Okay.
Okay.
Yeah.
I suspect that even on the low dose it'll work, because it's just to relax the blood vessels.
Yeah.
You don't really have high blood pressure that we're trying to bring down. Okay?
No, and I mean I do the running. I've and it started with like weight loss, and so I've lost 40 pounds, and so I changed my diet. I
Right.
don't
You've
eat
done
out.
all the right things.
Right, and so I'm like, I've done all the
Okay.
eating healthy,
Yeah.
running, so it's like, what else can I do? I can't do anymore.
Well, that's why I think that with
Yeah,
the way you
so-
described and the frequency, I think this is good to start. And it's not lifelong. If you
Yeah.
continue, because everybody can still continue to improve their lifestyle, and you find that at some point you want to try to go down on the medication, go off, then you'll know if it worked. Because
Okay.
when you go off the medication, if it comes back, then it didn't work. But the way I described it, I hope that makes sense. That
Yeah, no, it
what
makes
you
sense.
thought was healthy is not my idea of health. What Panera
Right.
calls clean is
I
not
can
my
do
idea of clean.
better.
Everybody can do
Right.
better. I can do better.
Yeah,
Right?
no,
So-
I totally get it, and that was really helpful
Yeah,
knowledge.
so cheese is another bad one. Wine is
True.
another bad one,
Yeah.
because those have preservatives.
Mhm.
Cheese has preservatives, wine has preservatives, and it's not the same for everybody. Everyone has different triggers. Now, to abort it, there are a class of medications called triptans. Triptans cause narrowing of the artery, vasoconstriction, and those will abort the headache like within 30 minutes or an hour. They're powerful. We could give those. They may get covered. They may not get covered. This one can be fairly generic, and so if you take this and then within a week you start to feel better, then you don't maybe need to abort it. When the frequency is not as bad, when the severity is not as bad, you might manage and then continue to change your diet. So it'd be a good idea to do one thing at a time, because the other medication gives you a little bit more side effect, because when it narrows the brain arteries, it narrows the arteries everywhere, so temporarily you get palpitations, you feel a little jittery. Once I stabbed myself with the medication, I thought it was a placebo. It was a sample. I thought it was a sample. Really, I had the medication, and boy, I could feel my blood pressure going up. But so I know what it feels like to get those medications. So we warn people about the side effects. But with this one, there's no side effect. It may be a little dizzy, but that's why I'm telling you, take it at night. So you're going to research the lowest possible dose, and then we'll see if we can even half that, frankly.
Okay.
Does that make sense to you?
Yeah, it all makes sense, and just like the 5 minutes of what you just said, I learned so much.
Good. So let's go back and recap. Go to sleep a little earlier. I know you're a mom, you've got a lot of responsibility, but look, this is your health.
Yeah.
And if you don't function well, then they're going to suffer anyway.
Yeah.
So to get buy-in by discussing it with them. In fact, next time, come bring them in with you,
Yeah.
your husband did. Go to sleep so your brain is rested.
Yeah.
The brain can resist problems and stresses. When you start in the morning, do not eat what we call breakfast. Nothing out of a package, no cereals. Right?
Yeah.
Not for your kids, not for you, but for your kids, it'll take time.
Yeah.
For you, you could do it quickly. Because what's stopping you having mashed potatoes and grilled salmon for breakfast? Nothing. That's what I give my kids sometimes.
Yeah.
Right? What's stopping you having, seasoned oatmeal? You can have sweet oatmeal. You can season it with garlic and pepper and salt, and then you put again scallops or shrimp, grilled shrimp on top with some peas around the side. My kids love it. They love the color.
Yeah.
Right? So this is real food, and those are less likely. I say less because you have to find certain foods might even give you head, but the preserves for sure will create that. And then you're already exercising, which is great. And there's pollen out there. Maybe that's going to be a trigger. Maybe it is. Maybe it's not. But try to get the whole family involved.
Yeah.
Then and do explain to your family what you feel. They can't see you inside your head. Your husband is good in understanding. But nobody can really understand what you're going through because they can't get in your head. So you have to tell people.
Yeah.
So get them involved, and you'll find that you'll get much more support and buy-in. And then when you explain about making the changes for your own well-being, they'll be more likely to do it.
Yeah.
Even if they don't look like they want to do it, over time when they keep seeing it, that's how your kids learn. They're going to learn by example. You're going to lead. So your adversity is going to actually be a positive. You're going to change yourself and your entire family. And you started off with an adversity, and it's going to turn into a positive, right?
Yeah.
Great. So anything else you want to ask me?
No. I mean, I get like really anxious, like, it's a lot of new information, so, but I mean, I'm going to try.
Yeah, I'll be here from next week. It's the month of Ramadan.
Mm-hmm.
I plan to be here every week. So if you want to come back in a couple of weeks,
Okay.
then I can follow up with you, and then we can go over what worked well, what didn't work, and then we'll go to the next level.
Okay.
Yeah, 2 weeks is enough time to figure out if
2
it's going to
weeks?
work. Yeah.
Okay.
So we'll do a follow-up in 2 weeks.
Mm-hmm.
We'll guide you as to how to get the prescriptions right now,
Okay.
and then write all your questions down.
Yeah.
Try to bring your spouse in here. Bring your
Yeah.
children in here.
Yeah, thank you.
Yeah,
I will.
okay.
Yeah.
Because sometimes you overlook things with children.
Yeah.
They get a little eczema, they get a little other problems.
Mm-hmm.
It's all to do food.
Yeah.
Yeah. So cleaning up your food, cleaning up their food could change the whole family.
Right. Yeah.
Yeah. Not expensive as well.
Yeah.
Taking things away is cheap.
Yeah.
Yeah. I say that because, a lot of people have to get organic this, organic that. That's super expensive.
Yeah.
And I'm not saying don't do it, but, there are more important battles to fight before you spend tons of money on Whole Foods.
Yeah.
That's why I bring it up. I don't bring it up for any other reason, because you could leave Whole Foods and have like one little bag full for like $50. Whereas when I go to certain supermarkets like Korean store, I come out with like a basket full for like $15.
Yeah.
Because you don't have to get everything organic.
Yeah.
So I'll go into all those details for you.
Yeah.
All right? Cool. Any questions?
Can you say again how frequently the migraines were?
Yeah.
Again?
Yeah, so the really bad ones are about twice a year, but then during the month I feel like, they're just consistent. Like the headache doesn't really go away. Like if I take Excedrin or ibuprofen, it suppresses the headache, but it doesn't really fully go away. And I always and sometimes like when I feel like the rain is coming or a sense of smell or something, I will feel pounding in my head.
Yeah. So
Okay.
when things linger, it's called a cluster migraine. It really doesn't matter if it's a regular migraine or a cluster migraine, they're all headaches for you. But
Yeah.
that's a terminology that we use when something just goes day after day after day.
Yeah, it just doesn't go away. It's frustrating.
And the big bad ones. And how about periods that sometimes trigger headaches?
Yeah, monthly ones, yeah.
They're probably worse than usual.
Yeah.
There you go. So at least once a month are the severe ones. Even though what she means by twice a year, the really bad ones, probably where there's an ice pick in her head.
Yeah, that's when like I just can't function. Like think Christmas time, like at the end, and or Memorial Day weekend, that's when they happen. Like or it's like I just know, like I write them down. Like around that time frame is when I take 2 or 3 days off of work, and I never miss work.
So you know we're going to change her life because she's not going to get it this Memorial Day.
Right.
We have enough time to make a change.
Yeah.
Good. So be optimistic about everything. Not only your migraine, be optimistic and be cheerful. Look forward to the day, and you'll find that that also helps your immune system.
Yeah.
You know, just
Yeah.
good.
So the dose for Rapamil, according to Apothecary, is 80 milligrams by mouth,
Yeah.
TID, but we'll just start with one every night.
Sure. There's two ways to look at it. There's a sustained release, which means that one dose will last the whole day, and then there are generics that might be twice a day. You have to look into it. Of course,
Okay.
generics are going to be cheaper, but I think the sustained release has been in the market for so long, there should be a generic version of that. So you
Yeah.
research the sustained release and give it once at night.
Okay.
You may not be able to, the drawback of sustained release, you can't break them because they're encapsulated in a way to
Yeah.
sustain them. And so I'm okay with that. Just use the sustained release once a day at 80 milligrams. You'll be fine.
Okay.
Okay?
Okay.
And you let me know if you're not.
Yeah. No, and I'll make a follow up in 2 weeks.
Yeah, that's it. And I'll be here. So.
Okay.
Great, thank you.
Okay. Thank you so
All right, good
much.
luck.
Thank you. It
Okay.
was nice meeting you.
Likewise.